Hey, everybody, welcome back to the podcast. We're here at The Pathway. My name is Taylor Hennrick, and I'm here with my co-host, Sarang Patel.
Hey, guys.
And what we're going to be doing today, we're going to be diving in on the future of mental health. Where are the trends taking us now? What are we going to be seeing in the near future? What do we see now? And how does it impact our mental health and how we receive these types of treatments? Let's dive in.
Let's get it. Oh, just kidding. So we're talking about, let's start with telemedicine first.
Telehealth, telemedicine. All right.
Telehealth.
What is telehealth for those that don't participate, those that have only done conventional in-office appointments? What does a telehealth appointment look like in mental health?
So based on insurance requirements, audio and visual component. Actually, I shouldn't even say that. It can be a component where the patient or the provider is not in office and the other individual is at home or somewhere else, technically, right? So a mode of communication is either audio or audio-visual. And for those of you who don't know, we don't dictate that. Insurance companies do. We get zero say on how it should be done or how it is allowed to be done. Obviously, you want it to be HIPAA compliant, so it's like safety. That's definitely there. I think everyone agrees with that. But the mode of how it happens and the requirements of audio-visual or audio alone are dictated by the insurance companies.
Okay.
So you can do your initial visit like that, or you could do your follow-up appointment like that, like we've been doing. For those of you who don't know, you could do either one of those. And sometimes it's good to have a nice blend. We call it the hybrid model, right? Where if you want to come in, and I believe, right, that as a patient or as someone who is a patient as well, right, for primary care, whatever it is, you should be able to dictate what works best for you. You are paying for your health insurance or getting your health insurance or provided your health insurance. And you, as the person receiving care, this is, I think, I'm speaking for both of us here,
That's fine.
should be able to dictate how you want your appointment. If you want to make a telemedicine, makes sense. If you want to be in person, you should be allowed to come in, right? Now, of course, if the company does not offer in-person appointments and they're a telehealth-only company, you're kind of screwed there, right, in that sense. But also, there's a variable where the clinician, right, the prescriber, the therapist, whoever it may be, may also say, hey, I think it's for your best medical necessity for you to come into the appointment.
Correct.
So that should be able, they should also be able to say, hey, you need to come into the appointment. Not force you to go telemedicine, but to be able to say, hey, I need to see you in person to check your weight, check your blood pressure, check your vitals, whatever it is, or put my eyes on you, whatever it is, or meet you. They want to do that, then you do that. There are other variables that come into play, control medication that come into there. And these are all like, federal laws and state laws and that kind of stuff, right? So we're just kind of reiterating the laws that are out there. We don't make that decision, like I said. But that's the gist of telemedicine.
Absolutely. And if I can take a second to expand on this, if you travel back 5 years ago, the conversation in mental health was not often centered around telehealth. Yeah. Obviously, I'm talking about pre-pandemic times, okay? So if you go back to prior to pandemic times, telehealth was still an option in more rural areas. The underserved populations were still allowed to engage in telehealth because there's such a lack of mental health providers out there. Speaking about mental health providers as a whole in terms of psychiatric providers, counselors, behavioral technicians, et cetera, the list goes on. So if you wanted to pull, I've said this a couple times, if you want to pull a silver lining from the pandemic, I do think it accelerated other modalities being able to be utilized in healthcare, specifically mental health.
Right.
Very small silver lining, not saying that the pandemic was good, but if we look at one thing that's helped individuals gain a greater access to care and be able to get quality of care, it is via telehealth. Our reach within the state of Michigan has extended beyond borders, beyond county borders, and I love that. I love that because it aligns with what you and I set out to do. Help more people, get people in the door, get them the quality of care that they deserve without having to wait 3 to 6 months, right?
Right.
Good. So you've explained how a telehealth appointment goes. For those who don't know how or don't know what telehealth looks like, usually it's via an application. You utilize something on your phone or your computer, iPad, tablet, you name it, and it's very easy to engage with a provider. Where I've seen it beneficial is for the adolescent or pediatric patient who doesn't have to miss a whole day of school now. They can maybe miss an hour of school, right, by participating with a parent. For the parent who's a working individual and has working hours similar to a 9 to 5, 8 to 4, you name it, they're able to field an appointment from a private space, obviously over a HIPAA compliant telehealth platform, but they don't have to miss a whole day or an afternoon or a morning of work.
Right.
The ease of transmission for those that are just doing your stable check-ins pertaining to medications, it's a wonderful, wonderful utilizable tool. And we are grateful to be able to keep a hybridized model. There are indications where the client should be seen in person and absolutely should benefit and can benefit from an in-person appointment. So I agree with what you've said so far. Telehealth is one aspect of where we're at now. I would also argue it is where we're going, because there is definitely a telehealth element that's going to play a role in the future impact of mental health. Hopefully. It is well beyond our pay grade to decide the future capacity of telehealth at a state level and a national level.
But that's what bothers me. So because we're here to talk about it, I'm going to talk about it, that I think that it's not fair. I think the general public doesn't have the education on how these decisions are made. I think a lot of people think that we as a clinician make the decision, right? First of all, we don't make the decision. No. Like we said numerous times, the insurance companies do. And some of these laws make the decision. And I understand you need laws, you need this criteria, like you definitely have to for inhibiting abuse. You can't just do a appointment via text message. Like I understand that there are certain ways to do things. You have to have regulations. Get it, 100%. But if a majority of clinicians out there want to do telemedicine and a majority of patients want to do telemedicine and are aided by telemedicine, then how can it be that post-COVID and every year the can gets down the road, we don't have a permanent solution? It's been freaking 5 years, 4 years. How do we not have a permanent solution yet on what telemedicine is going to be, especially for mental health? Like, it does not take that long to come up with this idea, right? And if it's been working for the last 4 to 5 years, and then to go back and say, well, it was all wrong what we did for 4 to 5 years, now we're not going to allow telemedicine, or you have to limit it.
Correct.
Then you just allowed us to practice according to the laws inappropriately for 4 to 5 years.
It's going to be a massive deterrent to individuals being able to continue with the services that they're getting.
Yes.
Significant. It will significantly impact my own clients, your clients, our company's clients, and clients across the state. Just speaking in Michigan, not even speaking nationally, right? About national bodies that offer telemedicine services. There are telehealth exclusive medicine or healthcare companies. That's all they do. It is bridging a gap that was previously there.
Yeah.
Absolutely.
And I think if you're going to put limitations, then it has to be. Now, this is not bias, but this is saying for someone who's still practicing and a patient for primary care, whatever it is, who won't go to the appointment because I won't take time off of work, so I'm a bad patient, like most people who work in healthcare are. You should, and if you're going to have requirements, make it a hybrid model. That telemedicine is allowed if the patient wants it, if the prescriber said it's okay, if they're on a controlled medication, sure, make them come in once every 2 years, whatever it is. You can make these hybrid models. But the more complicated these rules are, the less likely patients will get their care.
Absolutely.
And I think that what bothers me is that, and I will say we try not to make these too serious, right? But what bothers me as a healthcare provider and as a human being in general is that how can you limit somebody on getting access to care?
I know.
And if you've already provided it, the cat's already out of the bag, how are you going to retract on the whole entire process?
Right. These telemedicine flexibilities keep getting extended. Yeah. Nothing's been permanent. Everything is temporary. We are waiting on bated breath, waiting for an answer. And as a provider, it feels somewhat unfair because how do we guide and how do we expectation set with our clients without knowing a deadline, a timeline, or what is and isn't allowed?
And imagine talking to somebody for 4 years via telemedicine, and now the insurance companies or the laws say you have to see them in person. This person is 4 hours away. They're probably not going to be able to get to you. Maybe they don't have transportation, or they're a single parent, or they're a new graduate. They don't have the means to do that. They don't have the ability to do that. Or they're like me and they're just not going to do that. And now you have to say, well, because of these requirements, I can't see you anymore. There's no other reason. It's not that you're not doing better. It's not that your care is not good. It's not that you're not happy. It's that, well, because insurances and the law dictates it now that it changed, now we can't do it. Right. There's no other reason.
Clinical rapport will be broken. The client will have to go see another provider if they can even get in. Yeah. Most PCPs won't touch regimens that we maintain. So this person's going to be stuck.
And a lot of them should not touch it.
Their mental health is going to be abandoned, and they're going to leave it by the wayside.
Yeah.
which is unfortunate if something like this came to be. Now, this is why you and I are both advocates of a hybrid model. I firmly believe that in-person appointments are necessary. I firmly believe that telehealth appointments should be offered and are necessary for me to be able to keep up with my clients and to be able to give them the standard of care that I can offer. I need telehealth to stay. It's just being honest. It's me as a provider saying I am an advocate. It's worked. It's beneficial. I can still offer and deliver the same quality of care. End of story.
If mental health was not a problem in this country, and I'm not saying it's not a problem around the world, it is, but we live here. If it wasn't a problem in this country, then I could see you maybe having a conversation of a devil's advocate conversation, right? Mm-hmm. But if you're saying that in our adolescent population and our adult population, but mostly adolescents, the rate of suicide attempts has increased at a higher rate than any other country in the world, including the next top 9 countries in the world combined, our rates are higher. Clearly, there's a problem.
There's a problem.
So what are we doing here to kind of make this better, right?
This is why it's an endemic. This is why we have to shine a light on it. This is why we're here, because these individuals are so underserved. You and I read an article about another state. We don't have to name the state, but you and I referenced this article when we were speaking with Dr. Amin, and we talked about this other state where they anticipated a shortage of providers exceeding thousands of providers. And they talked about behavioral technicians, nurse practitioners, physician assistants, counselors, as well as psychiatrists. And they referenced that there was going to be a shortage. They were extrapolating the data, saying by 2027, there would be thousands of providers short on mental health care.
On just getting medications.
On just getting medications or delivering therapeutic services.
Yeah.
How are we going to be able to bridge that gap, make a difference with these clients if we start to pull back on some of the modalities that we currently have available? It will never happen.
But the worst part is, no matter what we say, no matter what we do, you can't really make a difference.
You're at the behest of an insurance company.
Or your representatives for the state. And we talk about like politics and that stuff, and I'm not bringing politics in here by any means, right? It doesn't matter what party you are, blue, green, red, blue, yellow, I don't care, purple, it doesn't matter, right? The conversation is that as a general human being and what's better for society, typically you vote, your beliefs, whatever it is, are for the betterment of what your beliefs are. Totally cool. How are we not doing what is best for human nature? So when you talk about, and we ask, representatives and congressmen and insurance companies and whatever it is, right? When you pick your health insurance plan you want to pick, right? How are we not asking the questions about what is your stance on this? How would you vote for this? How would you represent the patients, the community for this? And I think that's what there's a disconnect. And again, it comes down to education about how these decisions are made. And that's what's bothersome, is because no matter what we say, how are we going to go out, myself and you, and educate as many people as we can?
Right.
We try.
Right.
We try to tell as many people as we can, but does that really make a difference?
Man.
And that's the hardest part.
It is, because we're making a concerted effort. Our whole goal, going back to our very first podcast, we talked about getting clients in within 7 days. We'll never lose that. We will never lose that. We will always stand by that. We will see as many clients with as many different insurances as we are able to. That's always going to be our stance. That will not change so long as we're allowed, right?
Yeah.
To keep us on the pathway and move us forward, because telehealth is just one of our topics for today, let's talk about, I want you to lead us out on the potential role that you might see in artificial intelligence, or AI, playing a role in mental health in the future. What do you envision? What are you hearing? And what do you think it could do for us?
So I think, there's 2 different avenues. Some people, and I had this conversation with somebody that brought it to my attention earlier this week, is, we're looking at AI for our staff to make their life easier, not to make the decisions, but to make the life easier when it comes to documentation requirements, completing chart notes on time for insurance requirements, making sure that patients continue to receive the best quality of care that we think they can get. So we're using it as a tool to help and to aid, not to remove jobs, not looking at it to make the decisions for patients about what meds to take. Never will it make that decision, nor do I think it should make that decision. The computer should not make that decision, because every situation is different, right? And emotions play a massive role in how we treat and how we, empathy, I should say, how we should treat a patient, what should go on, like we talked about before. But with AI, what we look at and we try to say is, if we can make a clinician's life easier from a paperwork standpoint, right? And all people who may listen to this will definitely say that over the years, as they've seen their medical providers, whatever specialty that they're in, the staff has spent more time doing documentation than with the patient, or if they're in the same room, they're documenting while talking to you, because it's the requirement, because it's just the way healthcare has gone. It's a very heavy, litigious environment. You have to document everything totally fine. So if we can use AI to make it less cumbersome. If I'm seeing you and I'm having this conversation and AI is documenting it live, so we don't forget anything, we don't miss anything, and then you and I make the decision on what's the best treatment plan with therapy and techniques and goals and medications. And this is just a form of documentation, and the clicking aspect of it, from 100 clicks, we make 10 clicks, then that's a benefit.
Absolutely. Our goal here is not to remove administrative burden. Our goal is to re-emphasize patient care.
Right.
Patient care now encompasses talking to someone and documenting as fast as you can to make sure that you have the proper information. No, the point is the patient. Let's put the patient back at the center of patient care.
Yeah.
And that is the hard part. That is the very difficult part in our field and other sections of healthcare. It becomes so much about documentation, clicking, making sure that everything's in there, making sure everything's appropriate. It's like you're more focused on how the note looks at the end of the day than you were on the actual appointment. And again, I'm not speaking for our perspective. I'm saying you're absolutely right in that there's been a shift. And if we can utilize a tool that can come in and help us recenter our focus on the patient and, again, not remove administrative burden, but help the ease and the smooth nature of an appointment, then we're going to do that.
Yeah.
I agree with you. I think there's a place for AI. I think it can help with dictation services. I hope in the future that there's some sort of software that can help with scheduling and rescheduling. Again, not to remove the staff members portion of it, but to be able to just help to make sure that checks and balances. Yeah, to have checks and balances in place so that patient retention isn't an issue, so that patients have easier ways of getting in for care.
You know, I think what is troubling, and obviously as being some of the owners of the clinic, right, it's a little bit different, but I think that what the general population may not see necessarily is the hardest part about being in medicine and owning a practice and doing these kind of things is that you don't know if you will get paid on visits or not. And I'm not saying this about money necessarily, right? But once you understand that, I always give the example. If you go to get new tires, you know you're paying for this tire, and the tires come in your car, you know what you're getting, you're going home. When you go see an attorney, you're paying this fee, the attorney knows you're getting paid, you're going home. When you go to the grocery store, you're buying these groceries, same kind of concept. How is medicine the only field where you don't know necessarily if you're going to get reimbursed until after you see the patient? It could be months, if not years later before you get paid based on insurance requirements and all this. It's essentially nonsense. You've already seen the visit. The patient's already doing better.
The service has been rendered,
and you're not sure if you're going to get it because of dumb requirements. That is the reason why medicine becomes more cumbersome. It's not because we're living out these bougie lives over here as clinicians or anything like that, or patients aren't getting good care. It's because there's all this middle crap that's in there that needs to be looked at. So what we looked at is to say, hopefully AI can solve all this crap. That is, no one is even doing it. Like, it's not like you're taking away a job, but you're hopefully making the jobs easier for the clinician, for the patient, and from the front desk. Like across the board, an office manager. Everybody should be having a better quality of life, focusing on the patient ahead, the appointments, getting more people access, getting the younger kids into care, and less of this garbage that comes with medicine that is not in any other specialty.
I think based on how you and I speak about AI, we resolutely agree that AI has a place.
Right.
AI is being utilized in certain subsections of healthcare now, but I definitely think that it has an influence and a place when we look at the future of healthcare. Again, two humble individuals' opinions, but we are aligned on this. We definitely feel like AI has a role, and I hope that it's something that can help me improve as a clinician. That's what I want. Ultimately, I want to offer a higher level of care than I'm even offering today. I want to be better. I want to be better in the future. I want my providers that I'm responsible for to be better. I want pure psychiatry, ACPC, and Vital to be better. I want everybody to improve, and I want to be able to help our clients in a more effective manner.
Would you argue that you think that AI should then be able to give you the answer on what prescription to prescribe?
No.
Should it ever be able to do that?
I don't want to say yes or no, but at this point in time, my answer would be no. Ultimately, that should be left in the hands of the provider. That's what we're trained to do. That's why we went to school. And we're speaking from experience. A robot or an AI is not able to take into account what you mentioned: emotion, someone's affect, how they appear to you. I don't know if they're able to take into account the medications they've taken in the past. There are certain factors that I think have to be done at the human level. I would not feel comfortable with someone else making the medical decision for me.
Right. Especially with mental health, right? I mean, if you're talking about you're doing something else different, you have a cardiac profile, a cardiac algorithm, you kind of go through certain things, sure, it makes sense. You know what I mean? Are they eating cake? Are they doing this to control their diabetes? Whatever it may be. But with us, there's so many variables. There are so many variables that change. And you also have to be thinking about based on their life structure, based on the demographics, based on what's going on, could there be more variables? How is life going to be? Does life throw us curveballs? Are this person getting more curveballs? Do they have bad luck? Like, there's a lot of stuff that goes in this place that's like, yo, you have to make the medical decision. So,
and we have to know what to ask.
Exactly.
In psychiatry, it's subjective. We have to know what to ask. We have to get to the root cause. And if you don't ask the right questions, you're never going to get the answer.
Yeah.
So that's how we feel about AI. We've talked about telemedicine. We've talked about AI. Just very briefly, if you don't mind indulging us, what are you seeing on the clinical side? What are you hearing in terms of medication? What's recently come out? What's coming down the pipeline that you're aware of, maybe from a pharmaceutical level?
So I would say, and obviously I'm not the guru of like pharma world by any means, is of people that do like tons of research and that's what they're honed in on. So I'm not going to act like I'm like this like out here knowing every new medication to come out in the next 10 years. However, from a just general standpoint of someone's been practicing and seeing how companies are buying out of the companies and so on and so forth, we have seen recently in the last year, you could say, a couple of years if you want to say, there's been a big push on pharmaceutical companies investing more in mental health medications, which is good.
It's a good thing.
Or treatment modalities, whether it's TMS, whether it's ketamine, whether it's all these different aspects of treatments, different levels of treatments that can be there, right? Neuroimaging and all these kind of aspects, things that I don't even heard of probably that we'll go see at a conference this year and we'll be like, oh, wow, that's super cool, right? Above our pay grade. However, I will say that it's cool, again, if you want to see the silver lining from COVID, which there's very few to say, that there's been a push for big money to invest more into mental health treatment and methods of getting treatment, right? Telehealth we talk about. And that's really cool to see because I would say that before we started practicing, and if you look at the timeline of medication that came out, things came out for sure, but not at the rate they're coming out now.
Right.
Right? And I think that it's really cool to see how medications are cleaner, they're more accessible. Some of these pharmaceutical companies are really nice and they give you good copay cards so people who have high deductibles can still get the medication, which you don't see with other specialties, which is really cool because they're saying, hey, we want you to get the medication, we want you to try it, and you can see the differences, the benefits from you. That's awesome, right? Which, without dropping names, we use all the time. And they save patients money, they save patients the headache of getting their medications, they save us headaches as well, so it's really cool to see that. That's where I think it's really cool to see how medications and treatments that are new for mental health are coming in.
I agree. The level of advancement since you and I entered into psychiatry has been immense. I mean, I just think back to when we both started in psychiatry as PAs to now. Oh my gosh. I mean, look at how much the landscape has changed just in terms of medicine and our personal artillery or medications that we're able to use against various disorders. That's why I'm so excited. Because there's new science. There are new mechanisms of action that have come out since you and I started. And that's not that long, right? We're going to be doing this for a long time. To me, I'm like, what's next? Right. What's the next multimodal approach? What else are they going to come out with that's going to give me something that's a sure shot? I'm not just throwing a dart at a wall and hoping that I get the bullseye. I'm getting the bullseye every time. I think we're honing in on more therapeutic actions. We're honing in on new neurotransmitters to utilize and to modulate. To me, it's a very, very exciting time to be in psychiatry. Yeah. And I agree with you that as we educate ourselves, our goal as a company and as providers should be we should be the tip of the spear. Right. If something comes out and it's been FDA approved, why should we be skeptical to try it for our clients?
Yeah, I think, it comes down to, again, patient's comfort level, their history of medications, are they able to get the medication? Another annoying part about this is that you have medication that come out. Someone does really well with something that's new or semi-new. They're doing really well. Their insurance changes because they changed their job or their job changed insurance coverage, and now they can't get the medication.
Right.
Realistically, it should be very simple. If you're on this medication, you can show proof you're on the medication, doing really well, and it's helping you or saving your life, whatever it is. If your insurance changes, it should cover it as well, even though it's a different plan, different stuff, different premium, whatever it is. There's already a history of it working for you. So would you like me to go back to the drawing board and have instability because the new plan does not cover it? That's what we're required to do.
I know.
So I feel like 90% of the game is not saying what is best for the patient. It's, well, what's good for the patient, but what's also approved by the insurance companies, right? And I understand you need insurance companies. I understand that like there's stuff above our pay grade here for sure too. But being boots on the ground, that's like the hardest part about our job, I think, is the paperwork aspect of it. And then it's the aspect of insurance companies and how we don't know if they get the medication or not, or we do know that, we don't know if it's going to continue to be covered, all this kind of stuff, versus saying, hey, I don't know what to give you as a patient. It's like, I got some options out here that I think could work. And I understand things cost money, and I'm not saying that they don't cost money by any means. But if you look at that and you remove that aspect of it, you should be able to, if you can justify it's life-saving for the patient, then it should be given.
Mm-hmm. And I hope it's clear today that we're making our goals. We always want to operate within our guidelines. And our thing here today is not to poo-poo health insurances. It's not like this is a podcast to hate on health insurances. We are simply highlighting some of the significant deterrents and challenges that we face as clinicians on a day-to-day basis. And go to your primary care, go to see another subspecialty, they're going to voice the same concern. Get a group of individuals in a room that are providers on an ad board or in a forum, and they're going to voice the same concern. This is universal. These aren't just things that are unique to us, but it's a challenge that we have to navigate, and we have to figure out how to still offer that high level of care, that branded medication that we think is perfect for this client, and find a way for them to be able to access that medication, whether we're sampling, whether we're utilizing copay cards, whether we're helping them with financial assistance forms that they can apply to at the pharmacy level, right? There's tons of different things that can be done, but we do those. We'll take those steps. Like, that is one of the differences for us. We're not just going to say, yeah, let's go on an old school med and, this is the best we can do. We're just going to kind of ride it out and like let you be how you are. No, we're going to fight to get you on the best and the brightest. You've tried this, this, and this. Let's try a new modality. Let's at least talk about it. If you don't want to, that's your choice as the client. But you know what? We're going to at least offer you the best and the brightest. And as we ping our arrow towards the future, when we're looking ahead and we say pure psychiatry is the tip of the spear, we want to be at the forefront. We want to get educated. Bring your reps in, bring individuals in who can provide higher levels of education. Have our providers go to dinners, be a part of the larger community and educate yourself, because we want to be able to do this. We want to be a leading force. That's why us doing our research to see what AI's role can be is important to us. And I hope that is evident in our conversation today.
Yeah, I think so. I think it's crazy to think about there's some clinics out there that don't provide samples or that won't allow a patient to be given samples of medication. To me, that's just doing the patient injustice. It's not costing you anything. It's not causing any troubles. It's not giving bad medicine. You're literally giving an option to patients that hopefully, or unfortunately during a time of insurance changes or new year or coverage or trials or approval paperwork, we're able to get them the medication they can get.
Absolutely. Absolutely. We appreciate you sitting tight with us today. I hope it's been a fun one. We really enjoyed this one. It was fun to kind of dive in on where mental health is going. What's the future look like? Where are we at in the present? And where are we trending for the near future? Stop by and get on the pathway. We'll see you soon.